Most nurse educators are doing this completely wrong. They're spending hours developing content, polishing PowerPoint presentations, even adding more content to their course. However, our students are continuing to struggle. Here's the problem. The students are not processing the information that we give them when it matters, when they get to the bedside. When we need them to make those clinical judgment decisions, they struggle. They disconnect. They can't process the information in a way that allows them to make a decision. This is information that is not new. Patricia Benner has been telling us this for decades. She has encouraged us to bring the clinical practice into the classroom. And when we don't, students aren't able to truly apply and analyze those specific patient care scenarios that we need them to have practice with. We have to create more iterations, more experiences for our students to truly engage in this clinical decision making so that they can make those sound clinical judgment decisions. Welcome back, everybody, to Dr. Sellars Educate, where our mission is simple. It is to support all nurse educators on the journey to achieve excellence in the classroom. Now, for some of you, that is the goal of achieving your certification as a nurse educator. We do know that certification is a mark of professionalism. So we're excited that you are joining and really partnering with us on this journey to achieve excellence or to achieve your CNE. Now, here's the good news. It is not going to take you 8 years as it took me. It took me almost 8 years to pass the certification exam as a nurse educator, longer than any other certifications that I've been able to achieve. And here's why, because I didn't know where to start. I didn't know what resources to use. All right, so we're going to talk about what strategies you can use in the snapshot to help ensure that your students are not struggling when they get to the bedside, that they know not only what steps they should take, but they also know why. Why is it that they are, as an example, checking a blood pressure before they give metoprolol, even if the order is not written? All right, so we want them to understand that metoprolol is a beta blocker and it is going to decrease that patient's heart rate, that patient's blood pressure. So it's important information for us to know before we give a medication like metoprolol that's a beta blocker. All right, so what we want you to do, if you haven't already, go ahead and pull out and print out that study worksheet. If you haven't, that's okay. You can pull out a sheet of paper, and this is what we want you to do. First step is to write down today's date. If you're like me, I attend a lot of workshops. So it's hard sometimes for me to remember which workshop gave me this really important information, okay? Because oftentimes colleagues want to know, okay, where did you get that information? So that's first step, write down today's date. Second step is to write down what is an objective that you want to achieve. Now that you know what we're focusing on, which is going to be our responsibility as a nurse educator to help students achieve success. And when you look at the exam blueprint for the CNE exam, or even if you're on the CHESI journey or the nurse manager journey certification, we want you to think about what specific behaviors that are listed on your exam blueprint and how do your practices today align with those specific competencies, those specific behaviors. Your ability to achieve success on your certification journey, or even nurses or nursing students that are on this call or on this snapshot, watching the snapshot right now, maybe you're on the NCLEX journey. Consistently, the steps are the same. Number one, knowing the textbook to use. Number two, knowing exactly what that blueprint entails, because we know there's an NCLEX blueprint, there's a CNE blueprint, CNML, and CHESI. So knowing what that blueprint is also a really important part of your journey. And then the third step is going to be what dedicated time are you going to commit to focus on content that is aligned with the textbook, with the blueprint. As we look at our content today, that's what I want you to reflect on. Where are you on this journey to achieve excellence, to pass a certification exam, or maybe just to be 1% better every day? Our ability to consistently commit by showing up for ourselves and really investing in ourselves to become better is what we do in nursing, is what we do in nursing education. We want to focus on getting better so that we can better serve our colleagues, better serve our students, so that they can achieve success. All right, so you've already written down what your goal is, what your objective is for our time together. You've written down today's date. A couple of other points I want to mention, and then we'll transition over into our presentation content for today, as well as our thought-provoking question. Really strong nurse educators don't ask themselves, did I cover the content? They ask themselves this simple question. Can my students recognize those patterns? Can they actually prioritize based on the cues and make sound clinical judgment decisions? Content delivery is important. There's no question about that. When we look at the pedagogical framework, which says exactly that, we are the content experts, right? We are that sage on the stage. However, we also know that the adult learning theory, also known as andragogy, with the pioneer being Malcolm Knowles, his framework looked at the fact that as adults, we should be self directed. Now, we know that not all students are. We want to be able to coach them to guide them on this learning journey that David Cope talks about with his experiential learning theory model. We want to be able to guide these adult students to help them decrease their cognitive overload by aligning our content with the textbook, which also aligns with our blueprint to help them close their knowledge gaps and have clarity about what patient care decisions that they should make. If our students are memorizing those presentation slides, that's a problem. That means they are not able to actually apply the concepts, especially when it comes to a complex patient scenario. The issue is the learning design. It's not the content, it's not the amount of content. As nurse educators, we want to make sure that we are supporting that knowledge transfer that has to happen. We want to make sure we're helping our students develop clinical judgment. Okay, and so that's where we're going to start when we jump into our content. What does developing actually mean? What specific teaching strategies should that include? The question isn't whether or not you have taught the information, because we know that's happened, right? We look at alignment between the content and our learning objectives, as well as the teaching strategies that we're developing for our students to really engage on this learning journey. The question is really, have our students been able to process the information and learn it in a way that's going to empower them to think like a nurse? And I know we've heard that specific statement several times. It's not new in our literature, it's not new in our conversations. What specific strategies are we using to help our nursing students think like a nurse? Well, I want to take it a little bit deeper for us in this snapshot. I want you to consider what actual strategies are you using to help yourself think like a nurse educator? That's the key. That is what's going to help our nursing students become more successful and provide safer patient care. All right, so let's go ahead and transition over into our presentation for today. You all know that we use Prezi sometimes, but in this snapshot, we're actually using Zoom exclusively, and we're also using Canva, which is our platform that we like to use. We're going to start with our devotional. We wrote a devotional at Dr. Sellars Educate. Obviously, I'm the author. It's titled Rooted in Wisdom, Daily Inspiration for Nurse Educators. You can see our wonderful colleagues that have purchased the book, and there's information in the description if it's something that you think you're interested in as well. The reason why we even developed a devotional is because we have heard from thousands of nurse educator colleagues from across the country about the challenges that they're experiencing. Now, I'm a Christian. However, this book is not intended to convert you. However, if it does, that's great. It's really about having a deeper connection to your why. I want to share this specific encouraging word with you all as part of this snapshot. A single word of encouragement can change the trajectory of a student's learning journey. Students thrive in an environment where they feel supported, seen, and valued. It's interesting because I actually attended a retreat in Portugal, and we went to a restaurant that was called Scene. I thought it was an incredibly powerful title for a restaurant, right? It's simply called Scene. And by the way, the food was wonderful. So if you have a chance and you're in Portugal, then I encourage you to go to that restaurant called Scene. The customer service was fantastic. And it just created, you could feel in the environment the inclusivity that it really supported as part of its philosophy. That's what we want to think about. How can we help our students feel more seen, feel more supported, feel more valued? Learning is a partnership. So, our ability to truly help students feel that starts with our connection with our students, helping them see that we're human too, that we were a nursing student once, right? We all were. And our ability to truly help support them starts with our self reflection, thinking about alignment, specifically related to our learning objectives. Student failures actually start with us as nurse educators. How do we ensure that we have the right content at the right time, at the right level to align with those teaching strategies and learning objectives that we have to help our students achieve? Most nurse educators are doing this completely wrong when we look at the content versus developing clinical judgment. All right, so we wanted to talk about what is developing, what does that even look like in the class? So I want to give you all a couple of examples and talk about how it aligns with cognitive learning domain. Pages 188 through 190 again in Billings and Halstead's sixth edition is going to help you have a deeper understanding about those three learning domains. So a couple of examples. Number one could be developing an RCA, a root cause analysis diagram, after reviewing a mock medication error report to find system failures. That is at the level of analyzing because students are going to be given information and specific instructions that will help them really dig deeper into the why, right? That's what an RCA is all about. Second example is developing an original patient education brochure that explains post-stroke care using low literacy language. That is creating, right? That's that highest form of learning aligned with the cognitive learning domain. And then a third example is telling students that they are going to be developing a comprehensive care plan for a patient presenting with a complex multi-system organ failure diagnosis. That is obviously creating. So that's what developing can actually look like in your classroom, as assigning specific teaching strategies that are going to allow our students to not only apply, but also analyze, get deeper in understanding the why, as well as creating, which we know again is that highest form of learning. When we take a look at our thought provoking question, first and foremost, what we know for sure is that colleagues that score higher on a self assessment exam, such as the one by NLN, or even those that are getting the questions correct at the end of Dr. Caputi's CNE review book, second edition, it does not correlate with your ability to actually achieve that passing score on the CNE exam. And you may wonder, well, that doesn't make any sense. Well, this is what we know. When you're going through our thought provoking questions or any questions that you're using to help identify maybe where your knowledge gaps are, it's most important that you have a deep understanding about the rationale. Why was A correct and B and C incorrect? We are intentional in calling these thought provoking questions because that's exactly what we want to happen. We want it to stimulate thought in a way that really intrigues you to go to Billings and Halstead to have a deeper understanding of that concept. Colleagues are most successful when they follow two steps. First of all, having a deep understanding as to the why by using the textbook. Second of all, really doing an honest reflection of where you are related to the exam blueprint. Where are your knowledge gaps? Where are your strengths as well? What is it that you really need to focus on as it relates to closing those knowledge gaps so you're more likely to choose the correct answer when you get to the CNE exam? All right, so let's take a look at this thought-provoking question, and then we're going to talk about two key steps you want to take when you are reading every single question on the CNE exam. A nurse educator is revising a medical surgical nursing course. The course outcome states that students will prioritize care for patients with complex health conditions. Yet, most examinations primarily assess recall of facts, definitions, and disease processes. Which revision would best improve curriculum alignment? A, include additional notes from lecture content on examinations to reinforce key concepts discussed during class. B, revise assessments to include clinical scenarios requiring students to analyze patient data, prioritize care and justify decisions. Or C, review other textbook options to ensure alignment with the curriculum and current evidence-based practice. When you get to the exam, I want you to ask yourself two questions. Number one, and this is for every single question, what is this question really asking me? You know, there'll be part of your STEM will be a statement, or it may be a scenario like this one. And then the second part of that STEM is going to be a question. Sometimes there can be distractors in STEMs, right? And your ability to really discern that is an important step in you deciding which specific option is the correct option. You will have three options on the exam for every question. You will have 150 questions, and you will have 3 hours to take the exam. All right, so let's take a look at the correct answer, and then we're going to talk about why each, well, actually, we're going to talk first about why each one is incorrect, which one is correct, and then I want you to do a little bit of reflection. So we're mixing it up a little bit in this thought-provoking question. So A is incorrect because including lecture notes may reinforce knowledge acquisition, but it does not address the misalignment between the course outcome and the assessment, which was the question. Students are expected to prioritize care, which requires application and analysis rather than recall of content. When we think about lecture notes, we know students love when we give them the full PowerPoint presentation. They love when we give them notes. However, it doesn't allow them to truly process information in a way that supports their ability to learn. B is correct. So, round of applause for yourself if you chose B. Curriculum alignment occurs when learning outcomes, instructional strategies, and assessments are matched at the same cognitive level. Because the outcome requires students to prioritize care for complex patients, assessment should require clinical reasoning, prioritization, and decision making rather than only memorization of facts. Going back to what we mentioned earlier, I'm just going to stop sharing for a second just to increase engagement. What we initially started talking about is the value of students having that strong knowledge base related to concepts. However, they can't stay there, right? So there is value at the lower levels of knowledge and understanding, and our ability to truly get students to that application analysis level allows them to make those safe patient care decisions, strongly aligns with the clinical judgment model. Those are the steps that we want to take when it comes to our ability to truly support student success as nurse educators, thinking about what barriers are getting in the way, what barriers are we creating for our students that prevents them from going on this learning journey that is so important. In fact, we know it's life and death when it comes to patients' decision-making processes that our students are using and that our nurses are using as well. All right, so let's flip back to our presentation content and talk through the last question. Let's see, let me stop sharing for a second. Sometimes it gets confused because it wants to know, okay, what is it that you want me to do again? Going in and out of Canva. So let me see if I can get this going. All right, so as I'm pulling it up, you all can just think through your rationale. And I want you to also talk about so far, especially if you didn't get the choice correct, I want you to also think about what attracted you to the incorrect option. I know we haven't revealed number 3 yet, so we're going to get there. But I want you to start processing that information about the rationales in a way that makes sense to you. Because here's the reality. None of these questions, none of the practice questions that you see in any software for any, whether it's Caputi or the SAE, it's not going to be on the CNE exam. That's why it's so important for you to understand the rationale, and it's not most important for you to understand the specific or for you to struggle with why didn't you choose that answer. Okay, what we want you to have a deep understanding about is the rationale for the correct and the incorrect answer. So again, don't beat yourself up over the fact that you didn't choose the correct answer. We just want you to have an understanding as to the rationale for each of them, the 2 incorrect and the 1 correct. All right, so it looks like we're back now. And then last is C is incorrect because selecting current evidence-based textbooks, while it is an important part of curriculum consideration when we think about revisions we want to make, However, change in textbooks alone is not going to ensure there's alignment between our learners' outcome that we want them to have and the actual assessment. How we validating that learning has happened. The primary issue is that the assessment is not measuring at the proper level. Okay, so let's just go back and take a look at the question again. So, what was the goal? Well, we know for sure that a nurse educator is revising a med-surg nursing course. We also know that there's misalignment because what we've seen is with the exams, they have focused primarily at that lower level of blooms, right? So when we think about the ability to truly engage students on this application journey related to prioritizing care, which implies application and analysis, that's why B is going to be correct, right? Because we can see specific language, specific behaviors that we are going to take to ensure there's higher level learning that's going on with our students. Now let's take a look at some additional context related to these concepts. All right, so before we do that, we want you to do a little bit of reflection. So what's your number as it relates to these concepts that we've talked about so far? One, you feel lost, you have no idea what we're talking about. Or five, you feel like you're ready to teach. So take some time to do a little bit of reflection related to the thought-provoking question, what we've talked about so far, where you are right now on your learning journey as it relates to your competencies. There is a need for change. That's no surprise, I'm sure, to anybody that is in academia, that's in nursing. There are changes that we need to make. We're still not seeing the outcomes that we need to when it comes to safe patient care delivery, clinical judgment utilization, not only by our nursing students, but also with our nurses. We're going to focus on having a deeper understanding of what it truly means to develop clinical judgment versus what it means to teach content. Now, we want to do both. However, it's all about timing. It's all about making sure there's strong alignment to ensure our students are learning and that we're progressing up the levels of Bloom's taxonomy, just like those pages 188 through 190 talk about. Honing in on clinical judgment, taking a look, if you haven't already, at the NCSBN clinical judgment model. If you do a Google search, you'll find it. Thinking about, how do I assess? How do I make sure I'm engaging in those formative assessments? And how am I evaluating, right? So what specific tools am I using to evaluate and to validate learning? How am I engaging students on this learning journey? Do I give them a chance to truly reflect? What went well? What didn't go so well? What are they going to do differently next time? What specific strategies am I using to actively engage in the learning journey, just like David Cobb's experiential learning theory model talks about? What are those nurse educator competencies that are outlined in that blueprint? What are my current challenges? When it comes to our students, which are adult learners, we know there's lots of competing priorities. So, what specific strategies can I integrate within my learning experiences to make sure I keep my students on track? Just like you are watching the snapshot right now, there are so many other things that you could be doing. And oftentimes we do have a lot of drift when we think about our minds and processing of information. We've got to make sure we also don't have curriculum drift, where we're including content that's not aligned with our course, doesn't align with our learning objectives, and it may be an assumption we're making about students learning. So, how can we fix that? More formative assessments, which can simply be conversations we're having with our students. All right, so step number one, you want to take to make sure that we're balancing the two, making sure that we are developing clinical judgment and also that we have enough content that aligns with our learning objectives and our learners' outcomes. Number one, content coverage does not equal learning. Just because we have shared information with students doesn't mean that they've connected the dots. Sometimes we measure success by what we've actually taught versus what students can actually do with the information that we've shared with them. Making sure that we create, and sometimes it's not even about us creating, maybe it's leveraging the students' knowledge that we have in the classroom, allowing them to partner with other students and develop those unfolding case studies, especially once they have clinical experiences. Students can absolutely develop those unfolding case studies and share it with their peers to engage more hands-on with more hands-on experiences related to application of knowledge. Second step you want to take is to remember that we have to be intentional. When we're developing these teaching strategies, these scenarios, these hands on experiences, bring in those clinical practices into the classroom, we have to be intentional. We want to make sure that it's evidence based. And remember, we don't have to create all of these teaching strategies, right? There's so many resources available with our textbooks, looking in the literature, when we're members of professional organizations, finding out what other colleagues are using. Students need these opportunities for iterations, right? For practices, for multiple repeat experiences in order for us to give them feedback so that they're more likely to recognize those cues, process the information, make decisions about what their next steps are going to be, and then to evaluate to determine based on the decisions they made, what were the patient outcomes? What is it that they need to do differently next time? Number three, we know the value of reflection. It creates this deeper learning that we often talk about, making sure we take the time to debrief, even after the snapshot, allowing yourself to process the information that we've discussed. Think about how you're going to apply it. How are you going to align it with the teaching strategies that you're using every day? Guided questioning. We don't always have to give students a 10-question quiz to ensure that they are learning. We can have conversations with students using Socratic questioning, using open-ended questions that allow students to really process that information. The other point I want to make about reflection is that yes, there's value in doing individual reflection, and there's also value in doing group reflection. Now, I love this because, again, I just attended a retreat in Portugal, and that's a lot of what we did, really group reflection to think about how we can become better in the work that we're doing, how we can have an even greater impact with the communities that we serve. Thinking about that self-assessment. What opportunities do we have as individuals to get even better? That 1% better is true every single day. If we focus on getting just 1% better, think about the impact we can have long term. This self-assessment time also helps our students really think about their rationale for the decisions that they made. And we want to be right there alongside them to help them really gather their thoughts, to not be so hard on themselves, and to process that information so that they can be better informed about the next time. Number four, the best assessments actually measure learning and thinking, right? So we often think about those assessments only measuring learning, but the best ones actually measure both. Now, we talk about measuring thinking. This is all around analysis. So the rationale, the why. We want to move beyond those recall questions and truly create opportunities. The key word is opportunities for students to explain and to defend. This is why I love debate so much because it tells me so much about individual students, how they think, how they process information, and how they receive information too. When you look at debate, we have a group of students that support that statement and oppose that statement. I like to also have roles within the audience. And if you want to know more about that model, we'll put the link right here in the chat that really gives you a framework to use when it comes to debates. So again, you can find that link right here in the chat, and it will give you an actual PDF document that will tell you each individual role of a debate assignment to truly help engage all students, to allow them to process information and think about how they will either defend or support that specific statement. And then last, we want students to be able to apply those decisions that they've thought about, that they've made in their mind. We want them to actually apply it. We want to reinforce as nursing faculty their decisions that they are making. Or maybe we encourage them to make a different decision. I just wanted to share, as you all can see on the screen, an example of item analysis data. For those colleagues that are on the journey to CNE, you should expect to see a couple of questions that are going to ask you about not only what the data means, but what are you going to do? What action steps are you going to take based on the data that you have in front of you? All right, so let me just give you a brief example. So with this specific question, when we looked at exam analysis, we want to think about what information does it tell us? What we know is the p-value, which is difficulty, is 0.65. That means 65% of the students chose the correct answer. The question is that a bad thing or a good thing? Well, we know that that means that question was probably about right. That sweet spot is around 0.70. So it wasn't extremely difficult. It wasn't extremely easy, right? So that is around the sweet spot. Here's the most important question, though, when we think about analysis. What are you going to do with that information? How is it going to inform you about changes you need to make with that specific question? With exam analysis, you have to remember that part. So, yes, there are going to be some questions that are specifically going to be aligned with memorization, but only a few, okay? It's going to be most important that you understand what your next steps are going to be. What information does this specific exam question tell you about validation of knowledge with this specific concept? And then you can see also there's a little bubble that identifies the different levels of learning that happens examining, understanding, ideation, which we know is really important when it comes to thinking, experimentation, and then being able to distill, to discern what is my rationale for the answer being B, right? Being able to narrow our focus related to a concept and also have that deeper understanding all at the same time. We want to make sure there's horizontal alignment with the content. As an example, when we look at the concept framework for curriculum, we look at oxygenation and we want to consider how do we integrate concepts and learning associated with oxygenation in the at the junior level or in semester one, semester two, semester three. And then how deep do we go, right? That's that vertical integration. How deep do we go in each course related to oxygenation, right? And then we want to be able to distill specifically how do the learning objectives and the actual learning scaffold. In MedSurg 1, we shouldn't be teaching about oxygenation at the same level as MedSurg 2 as MedSurg 3. We want to make sure there's alignment and that there's progression. I know we spent a lot of time on number 4, all right? And then when you're processing information about what your next steps are going to be, I want you to remember this quote from Robert Collier, which says, "Success is the sum of small efforts repeated day in and day out." Okay, again, I want to say success is the sum of small efforts repeated day in and day out. We don't always get it right every time, but our ability to get better every day is really what it's all about. Going back in, looking at our content, deciding what our next steps are going to be to really build on our prior learning, just like our students do, is going to help us become a better nurse educator. If a student earns a 95 on an exam, but cannot prioritize care for a deteriorating patient, have they truly learned what matters most? That's the conversation that we want to have as nurse educators. Being able to quantify learning is important for that cognitive learning domain. So 95 is good. We still want to look at, though, what are the gaps associated with prioritizing care? And what are the next steps that we want to take to help our students be able to engage in safe patient care? 5 minutes. So when you're thinking about your answer about related to how we're going to better engage our students in clinical practice, we want you to think about where you are today. Okay, so pick one course, go back and take a look at those teaching strategies that you've integrated. And then the second step we want you to think about is how are you identifying and truly assessing learning over time within your course? How many discussions are you having? What formative assessments are you using to validate that students are learning that skill in week one or that concept before we get to week three? Because we want to build, we want to show demonstration of building on prior learning in a way that allows students to make those safe patient care decisions. Taking the time to pause, which I know is hard, it was hard for me too, to reflect and then to act. We don't want to just stop at reflection. We want to execute. We want to make changes in our curriculum, changes in the way that we deliver content, and the way that we engage our learners on this journey so that they can be more independent in consistently making those safe patient care decisions. So there's a couple of key teaching points and takeaways I want you to make sure you have nailed down. Number one, alignment begins with the outcome, not the content. We look at that from a backwards design model, and that's exactly what it means. We want to consider what is the end result. Well, we want our students to be able to make safe patient care decisions. It's not just about teaching the content, it's not just about reading those specific chapters. We have to make sure that students can actually prioritize, recognize those cues, and make those safe patient care decisions. Assessments should measure the same cognitive level as the learning outcome. When we have misalignment, then that's usually an indication that we have drift, right? That we don't have the right content at the right time to align with the learning that we expect our students to actually grasp, to actually have that deeper comprehension of knowledge that we know we need for them to have. The third component and takeaway I want you to remember, content knowledge is necessary but insufficient for developing clinical judgment. You can see here we have our bundles that we ship to colleagues on the CNE and 60 days journey. That's part of the framework. We don't want you guessing, purchasing other items, purchasing different textbooks. Billings and Halstead and Caputi are the only two textbooks that you need. And Caputi's optional. We like Caputi because it's easy to read, but the textbook you must have is Billings and Halstead. However, if these textbooks sit on your desk, that's not going to help you pass the CNE exam, right? You have to think about how can I not only have a deeper understanding of these concepts, which requires us to read, but also how can I integrate them into my teaching strategies? It's the same process we need for our students to have. Going into these textbooks, having a deeper understanding of concepts is going to help our students make safer patient care decisions. And then the last takeaway, well-aligned curricula prepare students to apply knowledge, not just simply recall information. We want to make sure there is horizontal alignment across courses within our nursing program and vertical alignment within each individual course itself. We want students to have a deeper understanding. In week one, it's going to look different than week 10, right? That's what we expect. We want students to have that deeper learning by the time they get to week 10. We don't want you taking 8 years like it did for me. It took me almost 8 years to get CNE off of my bucket list. I wasted a lot of time, I wasted a lot of money, and I was very frustrated because I didn't know where to start. We don't want you wasting time and money. We want you to avoid frustration, and that's why we're here. And we want to show you the exact plan to follow to support your success on the CNE journey. You can find more information at drsellarseducate.com, CNE underscore N underscore 60 days. It doesn't take a lot of resources for you to achieve success. It only takes focus. Focus with the plan is going to help you achieve success, and we are here to support you every single step of the way. We hope you enjoyed this snapshot, and we look forward to seeing you in a future program. Take care and have a great day, everybody.